You look great, Mr. Beatty.
Likewise.
You could be going to court. I would be in court. You'd be going there.
Good afternoon, and thank you all for joining us. My name is John Beatty. I am a business lawyer at Dunlap and Seeger and the current board chair for Rochester Area Economic Development, Inc. It's a real privilege to have so many of you here today. I am certainly looking forward to hearing remarks from Dr. Clark Otley, who has joined us, and learning more about Mayo Clinic's platform and the plans it has for that platform. We will look forward to hearing from Dr. Otley in just a few minutes. This is also a great opportunity with our virtual annual meeting to inform the community and absolutely share with our investors of RAEDI's efforts over the last year and the hard work that we will be taking on going forward. I've been tasked with sharing a bit about the last year, and I will take you to a couple of things. I naturally went looking for photos in my particular phone over the last year, hoping to find a bit of a St. Patrick's Day celebration. Obviously, those are years gone by for me, but maybe something reminiscent of a celebration, or perhaps because this time of year brings so many memories of the NCAA tournament. I was looking for any kind of reminder of that in the last year. I would not have been a North Carolina fan, but obviously, when I went looking for those types of memories in March 17, 2020, instead I scrolled my phone and found an action photo that appears like this. I will tell you that this is what we refer to as action business lawyering. Absolutely out of context, this photo looks about as mundane as any office work around the globe as you could have expected a year ago. But for me, as I look at it, it represents the last time that I remember being on the other side of this pandemic, living and working in a world that we thought we knew, we thought we understood, we thought we had some control over. In that photo are a number of my partners: Greg Griffiths, Dave Peterson, Hillary Stonelake Curtis, and of course, Sam Gill and Kathleen Harrington at the Chamber. And that day in particular, I remember, was a day full of heads and hands, some somber seriousness, panic, a lot of people dealing with the flight or fight reflex, and just pure adrenaline, as we all in our community around the world had great stress and concern for our families, our businesses, friends, client businesses, all of our loved ones around the globe and our community. I mean, I look at the photo and I'm it may be not as cringy as the first two photos with the great crowds, but it's pre-mask, it's pre-social distancing, pre-sanitizer, and I absolutely assure you it's pre any idea how to operate Zoom, though there's no assurance that I'll get through this without screwing it up yet today. But you stand back, and I'm sure for each of you it was a different journey from that day till today, recognizing we had no idea what lay in front of us. We still don't, but on that day and since then, we knew that we had to call everyone together, had to grab anything we could hold on to, and try to work together to make sense of what was in front of us. Before I break from that photo, I think another interesting point to make about it is it was not until March 18th, 2020, when the federal government passed what's called the Families First Coronavirus Response Act. I think that's what we were presenting on in the photo. That earmarked $192 billion. A week after the government had earmarked $8 billion for what it called Coronavirus Preparedness and Response Act. It then was doling out $192 billion, providing for expanded unemployment, sick leave, et cetera. Since that time, of course, there's been an additional $5.3 trillion in relief packages that have been passed federally, and we all have had different experiences with those locally. I share that story again, because I'm sure each of you have experienced a different journey, as exhausting as it may have been from a year ago to the hope that's in front of us today. We absolutely knew very little then. But I also share it because I say on March 18, 2020, we had no idea as to the stress that would be put on our local governments, our nonprofits, our private-public partnerships over the last 12 months or then the next 12 months. And we did not anticipate those federal relief dollars, even though, and as much as they were voted on 1,000 miles away and approved, my experience with those particular dollars and programs, and I'm guessing it mirrors the experience of many of you, my experience has been absolutely intensely local. In some respects, all of that relief money may as well have sprung up from the shallow depths of the Zumbro River. And perhaps that's as much by design of the programs, crediting it for the significant local control it tried to extend to our governments and to our organizations. And it was also likely the natural result of the isolation of COVID, where each community was effectively lopped off from the rest of the world, even despite these technological capabilities. We were all left really together to figure out as a community how to do best for ourselves during a time of so many unknowns. And the experience has taught me, for all the things we took for granted before the pandemic, for me, that's clearly St. Patrick's Day parades and NCAA tournaments, but we can never take for granted all of the work that happens every day to make the greater Rochester area and Olmsted County a competitive community, presenting attractive opportunities to people and businesses to get them to choose to locate themselves here, to move here, and to continue to do business here. This last year for me is going to be forever marked with memories of meetings with community leaders, elected officials, community members, clients, lenders, really all of you on this call. And the blurs have always been lined, especially this last year, as various organizations have taken turns jumping in, manning the helm of this community ship. And it's exposed, I'll say, the pandemic real vulnerabilities. We've known about them, but it really exposed them and tested them in our for the economy of this region as we seek to remain a competitive community. But it's also reminded us of the many great strengths and infrastructure we've been building here for more than 140 years. And we need to remember that as we seek to execute on and compete for post-pandemic opportunities in this greater Rochester area and Olmsted County. James Allen, an American author from the 1850s, is credited for saying this, and I'm sure you've all heard some version of it. But adversity does not build character, it reveals it. And I believe that the experience over the last year in this community has revealed the depths of the partnerships that have been forged, certainly for RAEDI, over the last 30 years. And it's made our relationships, our partnerships clearer and stronger. And for RAEDI in 2020, with broad experience, a great track record for serving as a fiduciary of public dollars, and with well-established partnerships, 2020 established that RAEDI is the right organization in the right place at the right time, able to leverage great partnerships and people to carry forward very critical economic initiatives. You've all got a virtual annual meeting packet in front of you. I submit and ask you to spend some time reviewing that and learning for yourself those accomplishments of 2020 that are restated very well in that packet. But I would remind, I have to call out the Economic Development Fund and the Southeast Minnesota Capital Fund as being two strong tools that RAEDI has really continued to benefit from, the community has benefited from, as we have grown and diversified the economy, added new jobs, new businesses. The successes of those tools are shown in the packet. The capstone event for 2020 absolutely is RAEDI's involvement in distributing, managing, and accepting applications for Olmsted County CARES Act dollars. The numbers are astounding as you step back and think about how quickly that tool is built, the volume of the applications, the fact that RAEDI's staff working on this is 3 to 4 people, and it handled applications from hundreds of businesses and in a matter of days turned around checks in excess of $6.7 million through 3 separate rounds. Perhaps the thing that I'm most excited about is insofar as the success of 2020, but for which any of you on the call might have the least information, is the fact that in April 2020, RAEDI commenced a strategic plan. Since that time, over the last many months, RAEDI has, with the help of a consultant, engaged more than 75 different stakeholders, public, private, nonprofit throughout the community, and engaged them in surveys, interviews, focus groups. That plan is going to our board over the next couple months for discussion and adoption, and has some very exciting strategies that we will look forward to implementing in 2021 yet and going forward. I say that 2020 also taught us a number of lessons as to where the opportunities lie going ahead. Mr. Wade will be speaking to these in a few minutes, but we absolutely have to continue to capitalize on the quick and early success of our Southeast Minnesota Capital Fund. We have identified some gap funding potential opportunities for a new fund that could provide for lending to new businesses, covering risk that traditional lending might not otherwise look to provide. We certainly, because of 2020 and the partnerships that I'm stressing, intend to extend and double down on those partnerships and work with other economic development agencies, our investor cities, Olmsted County, to find new ways to bring new opportunities to the area. First and foremost might be the framing up, building, and construction of a real front door of economic development here in Rochester or Olmsted County, where we can, with our economic development partners, greet and triage opportunities as they come knocking going forward. For all of that work, I can only acknowledge the incredible leadership and extend great thanks to a whole bunch of people that made that happen. First, I want the investors on this call to understand the depth and experience of the board at RAEDI and how it was the right board at the right time. There was incredible representation, engagement of area representation, other leaders in the community. We continue to be focused on engaging our base businesses and getting them involved going forward. But for the last year, this board really stepped up and did a lot of work. Thank you also to the Southeast Minnesota Capital Fund. Can't thank Mr. David Herbert, Harry Hoffman, LJ Johnson, and Janie Russell enough for the work that they've contributed to that particular fund, and we look forward to opportunities with that fund going forward. Equally, we're very grateful to the Economic Development Fund Committee and the great number of people who contribute a lot of hours identifying investment opportunities for new jobs, new businesses in the community, and continue to invest those dollars safely, well, with great return for the community. I have to thank the Executive Committee, Mary Blair Heft, Adam Benecke, Melissa Brinkman, and our previous board chair, Mr. Wade. That team stepped up in huge ways in 2020 to make sure that RAEDI was ready to serve and to deliver whenever it could. Probably the most important thank you among maybe the next two or three, but certainly to the phenomenal staff, Tanya Bernard, Molly Schmidt, and Sean Williams. Like the rest of the world, those three individuals could not have anticipated the work and the challenges that came about in 2020, and they delivered in a huge way. They are the strength of this organization. Those few people impressively stood up and delivered on programs that benefited the whole community. And I believe they're eager to continue to deliver on great challenges going forward. Prior to closing, I can't thank or close my remarks without acknowledging the great passion, energy, and leadership of Ryan Nolander. Ryan left our organization for an opportunity he couldn't pass up in September of 2020, but he deserves great credit for the efforts and success of EDF, the Southeast Minnesota Capital Fund, and for getting us on the path of new opportunities and for setting us forward with a strategic plan. And I can't say enough thanks to Mr. Wade. John, thank you for stepping in at a time when you were called on. Appreciate you serving as our interim president. You brought great experience, energy, and know-how to the position. For those on the call over the last 6 months, John's been very determined in focusing on a number of efforts, but especially in connecting with our investor cities of Byron, Stewartville, Chatfield, and Pine Island. I think he's been at some 6 a.m. meetings with those EDAs. And he's also to be credited with attracting a number of new investor relationships brand new to RAEDI, of base businesses with which we've not previously had a formal relationship. John, I'm thankful for your work and your dedication to the organization and the community. Most importantly, though, RAEDI investors, thanks for sticking with this organization and for your commitment to economic development in the community. The last year has taught us, as I've said, that we have to always be working, whether we're the leader, the convener, or a team player, to strive for new economic development opportunities to grow, diversify, and retain all that is good in Olmsted County and the greater Rochester area. And I submit that your investment in RAEDI remains a smart investment. I said this is the right organization with the right partners, the right place, right time, right community. And your investment will be and will continue to be effective as this organization finds new, bold opportunities to diversify, retain, and grow Olmsted County and the greater Rochester area. So thank you again for all of your contributions and to everyone that contributed to the successes of RAEDI in 2020 and to each of you for your ongoing commitment. I gladly turn the meeting over to Mr. John Wade.
Thank you very much, John. And I don't always make life easy for people, and I probably didn't for you this year. In some ways, as you got to be chair a little bit, maybe before you had anticipated that. But I can't tell you how much I appreciate your entire commitment, not only to this community, but certainly to this organization and to its investors, its constituencies, your continued commitment to all of Olmsted County and the entire MSA, and that includes a few other counties, to make sure that we're building this economic ecosystem in a way that many, many people can participate in. And you're committed to that. And I appreciate your leadership, both as a peer and now as my boss. That's why you go on about some of those things. But nonetheless, your parents have good reason to be very proud of you. So I happen to know them. That's the only reason I'd say that. But at any rate, thank you, John, and to the executive committee for all you've done. I also echo John's comments about this unbelievable staff. Some of them I have known a very long time. Tanya and Molly and Sean Williams in the entrepreneur area is really a brilliant mind. And I'm very pleased to have Sean joining our staff full-time, as well as, again, the great work of Molly Schmidt and Tanya Bernard, which is omnipresent in my life. So I'm very grateful to them. And John made mention of Ryan Nolander. I'm also very appreciative, and many on this call know that who have been involved or investors in RAEDI a very long time, the leadership of Gary Smith, because today when we look at the Southeast Minnesota Capital Fund, when we look at this unbelievable relationship that Dr. Otley will talk more about, much of that had to do with a guy named Gary Smith, who is happily retired now, but never hesitant to give me his opinion on things, which I'm grateful for. So just want to make mention of him too. I also want to make sure that we thank our sponsors today, and they include at the platinum level, Mayo Clinic, the event sponsors, Beneke Construction, Wendland and Utes, Bremer Bank, DMC, Frederickson and Byron, Hexam Companies, HGA, Home Federal Bank, Merchants Bank, Homestead National Bank, Think Bank, and West Bank. Thank you to all of those sponsors who have in part made our work possible, actually. All of our, we don't really call our investors members, they are investors, and we have a number of them, and they're included in the program for today. But these folks make a huge difference, and through our opportunity, and John referred to a number of the engagements that we get involved in. One of them has been a very large manufacturer in this area, Crenlo, and we have worked very closely with the city and Deed and others to ensure their continued viability. And I am also very pleased to say that for the first time in that company's history, actually, and Crenlo's been around here a long time, they have now chosen to become an investor of RAEDI because they see and they recognize that important work that we do. And I'm grateful for that investment, and I'm grateful for their continued investment in this community. That means a lot to all of us, particularly in the manufacturing sector. I will just say that our opportunities here are great. I think it was the great Mike Tyson who said, everyone's got a plan until you get hit in the face. And we got hit in the face, but we kept that plan going, the strategic planning process, which you've heard a little bit about. You'll hear a lot more about it in the weeks to come. As John said, it goes before our board soon. We are about strategically focusing on job creation and retention and making sure that all the base businesses that we have here today continue to be here. Businesses that want to expand here have the tools and the infrastructure to make that possible. That's why our whole world at RAEDI is about strategic partnerships, certainly with the private sector, certainly with the finance and banking community and the legal community, but also with manufacturers and government. Units of government are very important. This place is like a big Switzerland or a little Switzerland. We work with everybody. And this is not about politics in this organization. It is about how we can forge partnerships with organizations like the Department of Employment and Economic Development and the city of Rochester, Mayor Norton, President Carlson, the city council, and also the really great county board, which we have worked very closely with in administering the grant funds, but also really the strong leadership of Stephanie Podolsky as chair of that board, and our own Ken Brown, who serves on the RAEDI board as well. So we've got a number of great people that continue to be engaged and involved in our work. And there's other county board members and there's other city council members, but by and large, our direction is from the private sector. And that is certainly very, very important. You know, as we go forward, folks, we cannot continue to do things exactly the way we've done them before. And I happen to tend to want to be on the sunny side of the street, and I am really optimistic about not only where we've been historically, but the opportunities ahead of us, whether it's hospitality, manufacturing, other base businesses. I mean, look through that program, folks. Look at all of those businesses. And I have this opportunity to also sit on the capital fund, which was a $2 million private capital fund here. Got about $400,000 left. And we're probably going to be looking at another round of that fund in the $3 to $5 million range. We have the Economic Development Fund together with the city of Rochester. We are in discussions with the county about other tools. What could those tools mean? It could mean more investment along with the private sector to make sure that all people can experience this economic growth. And as I worked for Barbara Jordan years ago when she was chair of the board of the chamber, and we used to talk about that we not only want to do the right thing, we want to do the smart thing, and making sure that we build this community into one that is business friendly, but also allows everybody to participate in it. So as we look at additional funds, we want to make sure that women and minority owned businesses and base businesses and people looking to expand or invest here, working together with our partnership with our friends at DMC, CETA in the more rural area, or the neighborhood, as I like to refer to it, the Small Business Development Center. There are a number of partners that we have that help us do this really, really important work. But I do believe that really our brighter days are ahead of us. And you will hear more about that, not only from Dr. Otley and some of the amazing innovation that we are so blessed to have here, but remember that business not only is located in the geographic downtown of our area, but it's all over our area. Some 40,000 people a day come into this city to work. And those neighborhoods are important to us, and they want additional investment. You know, our partners that are also investors in RAEDI, including Stewartville and Chatfield and Pine Island and Byron, are critically important to our economic ecosystem. So we're going to get smarter how we do things. We're going to bring more people to the table, including construction, including developers, to sit down with us and the finance community to look at innovative ways that we can continue to retain and grow and diversify our economy. And I am excited about that future. And I think we all should be. Before I get a chance to introduce Clark Otley, I just, I do tend to stay on the sunny side of the street, but we lost a number of people this past year. And a friend to many was a guy named Gus Schafolis, and a really great guy. And I was wandering around his office recently, invited to do so. And I was looking at his calculator, and on his calculator was a note. And it said 3 things: use your head, stick your neck out, and work your butt off. And I think that at RAEDI, we will continue to pursue opportunities. We will honor our investors and our partners with more engagement, more opportunity for their own success. And I'm really grateful to everybody who contribute to making that happen. It is now my pleasure to introduce Dr. Otley. Now, if you look at my wall, there's one picture that happens to be a picture of the Plummer building. The door is closed after 9/11. I have one. And if you look behind Dr. Otley, you see that wall. So it may be indicative of a lot of things, and I'm sure my friends will text me and tell me what that is, but I need to read this, Clark, and then I'll add some comments before you get to talk. Clark Otley is a consultant in the Department of Dermatology at Mayo Clinic. He joined the staff of the Mayo Clinic in 1996 and holds the academic rank of Professor of Dermatology, Mayo Clinic College of Medicine. He received his undergraduate degree from Williams College in religion. Dr. Otley completed medical school at Duke University School of Medicine and completed his internship at Brigham and Women's Hospital. Completed his residency in dermatology at Harvard University, serving as chief resident. Upon finishing his residency, he came for a fellowship at Mayo Clinic. Dr. Otley serves as the Chief Medical Officer for Mayo Clinic Platform. This is very cool and very exciting, and he's going to talk about that. And is also the Medical Director for the Department of Business Development, which advances Mayo Clinic's mission through proactive business partnerships, mergers, and acquisitions, and the commercialization of Mayo Clinic technologies for the benefit of patients worldwide, while generating revenue to support clinical practice, research, and education at Mayo. He also, parenthetically, has a great partner in one of our board members, Jim Rogers, who is equally a wonderful guy. Dr. Otley also serves as Vice President of the Destination Medical Center Economic Development Agency, a 20-year economic development initiative to position Rochester, Minnesota as the world's premier destination for health and wellness. Dr. Otley has published widely. He is founding president of the International Transplant Skin Cancer Collaborative and has served as a director of the American Board of Dermatology. Dr. Otley received the Mayo Distinguished Clinician Award in 2015. I will tell you this, everybody who you mention Clark Otley or Dr. Otley to thinks highly of him and will often add a comment about, and he's a really nice guy. And while we may not all have the opportunity to interact personally with Dr. Otley, he really is that. He's a fine person and obviously has a very impressive background, and I'm looking forward to having him as an economic development partner as well. It is my honor and my pleasure to introduce to you Dr. Clark Otley. Clark.
Thank you so much, John. That is way beyond what the reality is. I'm a regular guy looking to do a good job and use my head, stick my neck out, and not make any mistakes. So really delighted to be here with you all and share some great information. What I'd like to do is share just a personal reflection first, then take you through some of the exciting things that are happening at Mayo Clinic and DMC and in our community, and then talk about maybe some of the synergies between the Rochester Area Economic Development Inc. Strategic plan and those of the other partners within the society. So first a little personal reflection. My wife Jill and I came to Mayo Clinic, as John said, about a quarter century ago. So I've lived in Rochester the majority of my life, I would say, and we have loved it. We have absolutely loved it. And we were caught by Rochester the way so many people are caught by Rochester, by the things listed there, the people, the community, the education, the values, and by Mayo Clinic. And I'd like to just reflect on those. When I came here, I went up, I had the good luck of training at some good places, but when I came here, I sensed something different. And I had pretty firm plans that we were gonna go back. I was gonna start a dermatologic surgery unit at one of the Harvard hospitals and have a really notable career. And as soon as I got here, I started rethinking that. And it was the people who I interacted with. And that's the core of what our city and what our community is. I'm a Midwesterner at heart. My grandparents grew up in Northeast Iowa. And always, my grandfather always wanted me to come to Mayo Clinic or the University of Iowa if I couldn't get into the Mayo Clinic. And he advocated for the Midwest values his whole life. And I felt those as soon as I got here, and they felt exactly like what I wanted to be part of and how I wanted to raise my family, my children, and to serve our community. The community that we have when we got here, an open-minded community, supporting diversity, supporting each other, growing the community, and really thinking beyond our own personal self-interest. The education, wow. Our kids went through the Jaguar, Comet, Panther sequence of schools, but we loved battling with the Spartans, the Rockets, and the Eagles. I mean, what an amazing educational program we have in a city that is just unparalleled. And then the Midwest values, and those were really very apparent to me in our interactions in the community and my interactions with our staff at Mayo Clinic as we took care of patients. And the big difference was at Harvard, people were trying to become great themselves. And at Mayo Clinic, we were trying to be great for our patients and great as a team. And as soon as I felt that, I said, I want to be part of that. I'm not somebody with a big need for personal gratification. I want to be the best doctor for our patients and for our community. And that has been something that's been just such a blessing to be part of at Mayo Clinic in this community. And I think this is one of our value propositions. John Beatty described, we need to bring companies here. We need to bring jobs and opportunities here. The life here is better than many places. It's better than I would argue most places because of the community, the people, the values, and the way in which we care for each other. So I'm bullish, as you can tell, on Rochester, and I'd like to share a few things about the journey we've been on the past year. So COVID has threw us a curveball. It was really challenging. It stretched us in ways that we didn't expect to be stretched on a global basis, a national basis, a state basis, and a community basis. And I was really, really proud of how we responded as a community. We had a can-do attitude. We became innovative. We learned how to protect our patients while they were getting the medical care they received, protect our staff, protect our community in ways that was innovative and allowed us to move forward, that path forward, in ways that were faster and more creative than we otherwise would have. We have a visionary CEO at John Rico Ferrugia at Mayo Clinic. For those of you who have met him, he is unrelenting in his demands that we can do better. We can do better every single day. And he is a transformation agent and recognized very clearly that although this pandemic would be very bad for us all, there was going to be a silver lining, and he was not going to wait around and dwell on the negative. He was going to take John's perspective and look at the bright side of the street and think about how can we transform things moving forward, and how can we continue those transformational activities moving forward even further. Contrary to everybody's expectation, Jim Rogers and I were thinking hard at the beginning of this pandemic. How can we preserve what we have? How can we anchor the gains that we've had and move things forward conservatively? And we soon realized that we could be much more aggressive in this time of pandemic, in this time of uncertainty. And it's because of a strong strategic plan. We had this vision that our board of governors and our board of trustees and our leadership set forward for us. And you say it in 2 words, bold and forward. We are going to be bold. We are going to move forward. And it's encompassed by the 3 words down below: cure, connect, and transform. And I'll take a little bit of time to discuss each of those aspects. Cure is what we do every day, better and better, day by day, hour by hour, month by month, year by year. We want to continuously improve how we take care of our patients, offer them new treatments, better treatments, more efficiently, more respectfully, more diverse, recognizing, and in ways in which we can continually get better. That's that 10% better every year. And we do that very, very well at Mayo Clinic. Connect. This is a new paradigm, and we've done telemedicine to some degree at Mayo Clinic in the past, but the pandemic really threw the gauntlet down for us and said, you've got to do that, and you've got to do that today or next week at very latest. And we instituted and brought up telemedicine visits and virtual care visits, remote patient monitoring, and what you'll hear about even taking care of patients with hospital level illnesses in their home. Some really inspiring things. And we intend to continue those connections and the virtual care because that helps us be there for you and for our families and patients on their terms. The final word is transform, and that's a word that gets me super excited. We will not accept being number one. That's what John Rico said. We are number one, not good enough. 10% better every year. Yes, we need to do that, but not good enough. He provoked us and said, I want to have Mayo Clinic transform healthcare tenfold better, tenfold faster, tenfold more efficient, tenfold more accurate, tenfold more personalized, to take this to that next level, that kind of Star Trek type care that we finally are possibly glimpsing at the ability to do, the ability to harness data to predict diseases, to orchestrate care that is very personalized and accurate for individual people, and to minimize complications. That's what I'm going to talk to you about next, which is the first quarter century of the 21st century was actually an amazing time for medicine. And I would say the most amazing things we did were in the area of biopharmaceuticals. The medications that came online were just amazing. And I was just in what we call Tumor Board, where we share stories and situations of patients who have difficult situations and tumors. And this was our skin cancer tumor board this morning. Group of doctors and nurses and nurse practitioners from all over the clinic, all over the country, actually, with Mayo's 3 sites. And we were talking about a woman from Michigan who'd had a 30-year history and battle with melanoma that just kept coming back on her arm. And she'd had incredible care from lots of different perspectives. And the most inspiring thing to me was that we still had a bullpen of about a half a dozen things that we could use to try to cure her, or at least prolong her survival with that disease. That didn't exist 20 years ago. And so the great leaps in biopharmaceuticals was maybe the defining point of the first 20 or 25 years of this century. Moving ahead, I think digital technology and healthcare, artificial intelligence applications is where we're going to make our biggest advances. And you can see this concept of the Mayo Clinic portfolio, Mayo Clinic platform, which John Rico Farrugia came up with about 2 years ago. And he came knocking on the door of business development and asked Jim and I, can you help me out? I've got this idea. Platforms are present in many industries, and they're transforming things, making things more personalized and delivering services that delight people. Can we do that with healthcare in a way that protects people's privacy and also is highly accurate and trustworthy? So Jim and I and Emily Wampler and all of our business development team went off and we talked with all different people all across the country, all across the world, all across Mayo, and asked the fundamental questions. How can we do better, powered by artificial intelligence, massive computing power, and big data in a privacy protecting way? And this Mayo Clinic platform concept started to come to fruition. And there are 3 levels of the platform. The first level is this concept, this ecosystem, a portfolio of initiatives to transform healthcare through digital technology. And make no mistake, John Rico does not want this to be an academic exercise. He wants products, services, and solutions that help people get better healthcare more affordably, more accurately, more accessibly. This is not a theoretical exercise. So we started and we created a large technology platform. So we've got a big computer with lots of wires and it's extremely secure. And then we started to think about how can we actually have the impact? And we came up with 3 initial platforms: the clinical data analytics platform, virtual care platform, and remote diagnostics and management platform. I'll take those one by one. The clinical data analytics platform, think of that as the world's most powerful research and development engine around healthcare information and technology. It is a privacy protected vault of lots of de-identified data. So they know they have my data. They know that I'm a 57-year-old man with certain past medical history, a certain genome, but they don't know I'm Clark. They don't know I'm married to Jill. They don't know where I live. We strip all that off. And then they try to make correlations between what my medical problems are and my predicted medical problems, and lots of other correlations from all the medical literature, all the patents, lots of genomes, microbiomes, X-rays, pathology slides, and boil all together. It's advanced mathematics, and they're looking for vectors of association to say that person with that particular constellation of problems does well with this treatment and does poorly with this. So instead of a trial and error period, I get the right treatment at the right time. Very inspiring. The next one, virtual care platform. We talked about digital health before, and this is the spanning of the entire spectrum of thinking about health information, having a low-level medical problem, moving on to a chronic problem, and then having acute exacerbations that might land you into the hospital. And one of the things we're doing with the virtual care platform is taking care of people who have high-grade illnesses, not ICU illnesses, but high-grade illnesses that would usually land them in the hospital in their home. Wow, how do we do that? We bring in an advanced telemetric remote monitoring platform. We have a command center down in Florida. We bring in products and services and people into people's homes and set them up so that they can be in the comfort and safety of their home while being monitored 24/7, 365 by doctors and nurses from Mayo Clinic. Doctors and nurses from Mayo Clinic, Florida, are taking care of patients right now in their homes in Eau Claire, Wisconsin. And we're going to be rolling this out to broader and broader areas. The results are amazing. Patients, they usually cry because they're so happy to be in their home and not pulled into a hospital. The results are better in terms of complications, outcomes, less readmission, and impressively less cost to the medical system. So very excited about that. We're going to transform healthcare through that platform. And then the final platform is this remote diagnostics and management platform. Wow, this one's a really, really big one. This is, think of it as semi-autonomous human augmented medicine. It's taking all the different data that we would love to know about our patients and boiling it together with advanced analytics and presenting it at the point of care for our patients and their families and their doctors so that they can talk about things in a very intelligent, data-driven way and make the best choices for themselves based on information gleaned from millions of patients applied to an individual patient situation. It's really inspiring. It's a big lift. We've got lots of work to do on it, but this one is really a transformative platform. We're also doing other things outside the platform. We have an advanced diagnostics lab located over in Discovery Square, advancing through Mayo Clinic Laboratories, the next generation of tests that will help us further define exactly what kinds of conditions people have on a personalized basis rather than a broader defined basis. And then we've got big plans in the biomanufacturing area that are hopefully going to be coming to fruition in Discovery Square too. And then we're working with John and RAEDI and lots of groups, including Collider and Medical Alley, to consider a robust ecosystem and front door for innovation within Minnesota, up in the Twin Cities, and then in Rochester. When we look out the window, you can see Discovery Square 1, amazing things being done in there right now, trying to develop cures and more precise medical therapies for patients. Relationships with Google, Boston Scientific, WuXi, Exact Scientists. We love our relationship with the University of Minnesota and all those bright young students. Collider's been phenomenal. RAEDI, Medical Alley. It's just an incredible, robust community of people who want to make things better continuously. We topped out Discovery Square 2 just the other day, and we're having really great conversations with some very impressive groups, companies, and firms that are very interested in locating in that area. When I think about our local ecosystem, we're very, very fortunate to have such synergies between the different groups. Everybody's aligned on innovation and job creation, the RAEDI work plan, the goals of DMC, and the strategic plans of Mayo Clinic. They're completely synergistic. We all want to pursue job creation and business attraction. Discovery Square is a magnet for that. And the fact that Mortensen broke ground during a pandemic, knowing that Mayo Clinic and the city of Rochester could attract that kind of economic activity and scientific activity, is a huge vote of confidence. We are supporting and continuing to grow an ever more vibrant entrepreneurial ecosystem with all sorts of events, both inside Mayo Clinic and in partnership with our community partners. And then the enhanced collaboration between the public and private sector manifests through Destination Medical Center, and the accomplishments that we've had in that regard are truly phenomenal. I'll just share a few closing thoughts on the pandemic. This is what I'd like to see, and I think we're starting to see it. We're seeing the dawning of a new day, a beautiful vision of our country, our community coming out of this strong. We've been through some terrible times, but we have better times just ahead. The vaccines are truly a miracle of science, and they have been invented not over the past year, but over the past 5 years with Nobel Prize winning technologic advances that set us up in a position to have a vaccine created and commercialized as rapidly as possible. So kudos to the scientists who developed that. Kudos to the healthcare workers who've delivered that in the face of all the uncertainty. And kudos to you as our community members and our businesses who have maintained the fortitude to just keep going during this difficult time, become creative, make adaptations to your businesses to keep thriving, so that as we come out of this, and we will come out of this very well, probably better than most communities in our country, with an aligned purpose and aligned vision, focused straight and narrow on success of our community. So I want to thank you for all the hard work that you do. I know it's very hard being a business owner, and what you do makes a gigantic difference to everybody in our community as we have vibrant businesses and economic success that trickles to all of our community. So thank you so much for your time, and I'd be happy to engage in a dialogue with you now.
Thank you very much, Dr. Otley. I'm inspired by, I thought that was interesting, Dr. Farouja's comment about being first is not good enough. And, you know, we find, and for those that are viewing today to know that, you know, none of us organizationally are as big as this enterprise Mayo. But one of the things I just want to convey is how in working with you, in working with Jim Rogers, your team, you talked about others, Collider, Medical Alley, DMC, and others, that really you do treat us like real partners and truly work with us to take that innovation and help continue to grow and develop this community. And I just can't tell you personally how much I appreciate that. And it's not new. You've been doing this a long time. But I think it is important for those that don't interact with you on a daily basis or a regular basis, that commitment to that partnership and to that community. And when I say the community, it's the broader community. It really is the county and beyond. And I'm incredibly grateful for that. And I think too, that front door of economic development and what that can look like with those partnerships, and how many more people we can serve, not only as Mayo likes to say, not only in patient care, medical education, research, or the other totality of your work and what you're charged to do, but Mayo has a very real interest in the continued diversification of the economy. You have any thoughts on that and why that broader community and starting up those other businesses that may not even be Mayo owned are so important to Mayo?
Thanks, John. Those are great reflections. And I'll go first to your point on partnerships. We hugely value the importance of diversity and reaching all out and partnering with groups from all over. We will be stronger every day if we do these things together. The other thing we recognize is you never know where that incredible bright insight is going to come from. So Jim and I learned long ago, you can't control innovation. You do not want to control innovation. You want to let it flourish. And so the more we can seed activity out there, when something bubbles up and we can be a part of it and help it scale, we're all game and we're all in on that. And if it's something that's non-medical, if we can help out with connections and things, we're all in for that as well. The diversity of the economy is absolutely important. We're in a weird situation. We're in a gigantic medical center in a small to mid-sized Midwest city. And so we've had the great fortune that people will want to come here from vast distances. And it was amazing to me to see how much people wanted to come here. I had patients flying internationally to see me in the middle of the pandemic for various types of skin cancer treatment and surgery. And that just shows the confidence they have in Mayo Clinic and in our community. And I would have to say, I'm so proud of the way our community treats our patients. Patients don't spend the majority of time with me and the nurses and the other doctors. They spend the majority of time in our community, and they are so well treated and respected. And that makes their experience here extremely special. That the community is the magic of Mayo Clinic.
Thank you very much. And that is so critically important. I think that, to your earlier point, I think the patient spends like 70% of their time outside of the clinical environment. But as we look at business and areas for expansion, I know that there are some things going on related to some very substantial investments in our community. We were all excited about Google for a lot of reasons, but there are actually bigger things going on. And without maybe naming any of that at this time, but to talk about what do you see the future of Discovery Square 2? And I think the other thing that's important for people to know is I happen to get to watch it being built outside of my window. But it's about so much more than that, because not everybody, although they're beautiful buildings and they've got really some great infrastructure, but not everyone's going to go to those buildings, which is why we're seeing them out at the Rochester Technology Center, former IBM, or other locations that that investment continues to expand beyond the heart. But talk a little bit, if you would, maybe about that Discovery Square 1, 2, and just how you see that evolving.
The Discovery Square ecosystem is a really great focus for interactions of our kind of industry partners and Mayo Clinic experts. The closer that we get, the more interactions that we have, which have converted to virtual over the past year, the more those great ideas come out of it. The fact that, again, we broke ground on Discovery Square 2, we've got great interest. I would say broadly, we've got interest across all the sectors of technology and healthcare. We've got diagnostic companies that want to work with us. We absolutely have healthcare information technology companies, prognostication companies, device companies, and biopharma companies. I'm super excited, obviously, for the partnership that we have with Google. That's an incredible journey that we're on. I'd love to spend an hour on every one of the strategic initiatives that we have going. I'll give you a glimpse into one. Right now, radiation therapy for cancer is delivered at high-tech centers, unevenly distributed around the country and very unevenly distributed around the world. There are places where you cannot get radiation, even though it's a core component. We're working with Google to have what's called auto segmentation to reduce the time and improve the accuracy of the computer planning of that radiation plan, so that only your cancer gets treated, but not your brain and your eyes and the other healthy organs. We also think that this can be extended through virtual care across the world. What an opportunity. This is the creation of a new industry, and we think an industry worth of collaborators and partners will be attracted to Mayo Clinic in Rochester, Minnesota, Phoenix, and Florida to collaborate with us. So one example of many. There's too many to recount.
Well, Dr. Otley, thank you very much. And no one ever complains when we let them out early. Only your friends text you during a meeting like this, and one of them happens to be a patient of yours, and said, "John, you have a lot more real estate on your head than I do." And Dr. Otley may be removing something from there someday. So, and he said you're very good at it. So that's always nice to hear. But at any rate, I am grateful that you came to spend some time with us, and I'll take you up on your offer in the future. And as we look at that front door of economic development and what that can look like as we work to build that out with you and your team, it's that commitment from Enterprise Mayo, from your area, is really deeply, deeply appreciated. And I'm grateful for your time today. And a special thanks to our board of directors and investors who make our work possible. We are going to, the strategic plan is going to be out shortly. We will share that with all of our investors and publish it, so everyone will get a chance to see where we are going and growing forward. And we look forward to continue engaging not only with folks like Clark Otley, but so many others. So on behalf of Rochester Area Economic Development, Inc., I'd like to thank everybody for joining us today. So thank you very much and have a great day.
Thank you,
Thank you,
everybody.
Dr. Otley. Thank you.